Hello guys, I'm Dr. Arunashish Mandi from Oral and Dental Healthcare Clinic, and this new channel has been created by myself. In this video, I'll talk about the speed of the intraoral X-ray film. At the end of this video, please subscribe to this channel and let me know about the related inquiries and more relevant videos you want me to discuss. So today's topic is speed of intraoral X-ray film. So what is intraoral film speed? This refers to the amount of radiation required to produce a radiograph of standard density. Now, what does the standard density mean in radiology? Here it means the degree of darkening of the film. As the speed of the film increases, the amount of the radiation required to expose the film decreases. Film speed is determined by the following factors. Number 1. Sizes of the halide crystals. Silver halide crystals are photosensitive and composed primarily of silver bromide and to a lesser extent silver iodide crystals. The mean diameter of the silver halide crystals is about 0.70 to 0.75 mm. Now coming to the next slide. Film speed determines the amount of radiation and exposure time required to produce an image on the film. For example, the first film requires less radiation exposure because the film responds more faster as the silver halide crystals present in the emulsion are larger. Thus, larger the crystals, faster the film speed. The smaller the grain, slower the film speed. The photosensitivity of halide crystals is further increased by incorporating gold or sulfur contamination during the manufacturing process. Although the incorporation of gold contamination is less common than that of the sulfur contamination. The disadvantage of using fast films is the reduced contrast quality and the less details or definition of the radiographic images obtained from the fast films as compared to the obtained images produced on the slow film. Now, what is the definition of contrast of a film? Contrast is the difference between the dark and light regions of a radiograph. Film with high contrast is more desirable for diagnosis. Yeah. So, factor number two is the thickness of emulsion. So, what is emulsion? It's coated on both sides of the base containing silver bromide crystals suspended in gelatin based on the presence of emulsion coating on a base of film. Now, there are two types of films. Number one is double coated film, and number two is single coated or single emulsion film. Putting emulsion on both sides of the base doubles the amount of silver halide crystals and thus increases the film speed. Single emulsion film produces better detail in image than the double emulsion film. Fact number three is the presence of special radiosensitive dyes. Screen films use W-shaped grains of silver halide to capture image. Green sensitizing dyes are added to the surface of the tubular grains to increase their light absorbing capabilities, for example, intensifying screens. Now the next slide. An alphabetical classification is used to identify film speed. The films are given speed rating from A speed to F speed. A speed is the slowest and F speed is the fastest. American Academy of Oral and Maxillofacial Radiology recommends E or F speed film to be used. E speed film is twice faster than D speed film. If speed film reduces radiation exposure 20% compared to E-speed film and 70% compared to D-speed film. Although at present D-speed and E-speed Films are widely used in each other.